For several years, bills have been proposed in the legislature calling for legalization of marijuana for medicinal purposes. Those bills have routinely died in committee without discussion. Last year, a medical marijuana bill did receive a committee hearing, but stalled there. This year, Oklahomans are coming forward to put a face on the marijuana debate, including men and women with compelling stories about children who are seeing dramatic results from marijuana in the treatment of serious illnesses.
In Oklahoma.
A survey of Oklahomans taken last year by the firm Sooner Poll shows a significant shift in views on medical marijuana and decriminalization. 71% now favor allowing the use of medical marijuana, 57% favor decriminalization of possession of small amounts, 64% favor treatment instead of incarceration for marijuana offenses. On Wednesday, hundreds of people showed up at the state capitol to make their feelings known before a Senate committee. Senator Constance Johnson of Forest Park has two bills this year that would change current marijuana laws. One to allow for medical marijuana, and another to legalize and regulate its recreational use. Johnson's legalization bill is already being described as dead on arrival. While her medical marijuana bill may not become law, the committee meeting allowed lawmakers to hear personal stories, like those of Virginia Spencer and Marty Peel. Spencer is the mother of 5 children, including 9-year-old Ava Grace, who suffers from 2 forms of intractable epilepsy. The child suffers almost constant seizures, many too slight to notice, others that are violent. Treatment has included up to 24 prescription drugs.
Sodium valproate is one of the medicines that has caused my daughter to sit in a corner, stoned out of her mind, staring at the ceiling, drooling, ripping her hair out of her head right before our eyes. We took her off that medicine, and we've tried 23 other medicines.
Marty Peel has a similar story about his granddaughter Zoe, who has Dravet syndrome, which also causes almost constant seizures.
So imagine your baby granddaughter, your little girl, on 24 different prescription medications, and still the doctors can't tell you if they're going to work, and they don't work.
Both Virginia and Marty give credit to a native Oklahoman, Josh Stanley, and his brothers for perfecting strains of cannabis that are high in particular compounds known as cannabidiol, or CBDs. Josh Stanley owns a chain of medical marijuana dispensaries in Colorado. He and his brothers produce a specially developed cannabis that is high in cannabidiol for children like Ava Grace and Zoe.
We're finding that the use of this plant is providing incredible, dramatic impacts in areas like cancer, epilepsy, obviously, Alzheimer's, Parkinson's, multiple sclerosis, muscular dystrophy, lupus, diabetes, arthritis, AIDS, HIV, chronic pain, heart disease, among many, many other types of conditions.
And even the Oklahoma Bureau of Narcotics and Dangerous Drugs has examined the science and finds value in medical marijuana.
There's more and more research showing that the CBDs or cannabidiols in marijuana are very beneficial, and we certainly support that.
Drug Bureau spokesman Mark Woodward says, however, the Bureau opposes smoking marijuana.
We would certainly support more research into making available non-smokable forms of CBDs, just like we've got non-smokable forms of THC that can give people the medical benefits through suppositories, patches, pills, without the smokable impairment.
Woodward says the Bureau suspects that supporters of medical marijuana have a hidden agenda.
Our concern is that people are using the medical argument as an excuse to get stoned.
Josh Stanley says contrary to what many think, cannabis that is high in THC content also has medical value. His company is growing strains of cannabis, some with high CBD content, some high in THC content, and combinations of both for medicinal use.
In these varying ratios, we're putting these together in order to conduct studies and targeting various illnesses and disease states.
Virginia Spencer believes a combination of CBDs and THC would help her daughter.
For patients like my daughter, there's no telling if cannabis will stop her seizures altogether. And there's no telling just how much THC she will need to help her with the sleeplessness and nighttime seizures, etc. But to say that there is no research is an incredible misconception and ignorance.
But there is one big difference between Spencer and Marty Peel. After seeing the CNN documentary by Dr. Sanjay Gupta, Peel made the decision to go to Colorado and move his daughter and granddaughter there so Zoe could get the medicine that works.
And that started our journey. And her first dosage in Colorado Springs, she was crashing. We were going to have to call 911. And she got her first dosage. And it's just a small amount. Probably doesn't fill the bottom of a teaspoon. An oil. And within 15 minutes, a seizure had stopped. She slept the whole night for the first time in 6 years.
For Virginia Spencer, moving to Colorado would mean leaving her husband behind. She says they do not have the resources to relocate her and 5 children in another state.
In the past 3 months, she has been placed on hospice. And we are at the end of the road unless you vote to save her life. How many of you would like to sit down with doctors and fill out form after form of what to do when her heart stops again? Because it has stopped 5 times in the last year.
The choice was clear for Marty Peel, but he still didn't like having to make it.
I was born in Perry. I live in Perry. My daughter is from Oklahoma. My granddaughter is an Oklahoman. Why would we have to leave the state that we love to save her life?
Norma Sapp is the state director of the Oklahoma chapter of the National Organization for the Reform of Marijuana Laws. Her organization commissioned the Sooner poll that shows nearly 3/4 of Oklahomans now favor medical marijuana.
These are the people you live next door to, the people you go to church with, the people that you work with, and you don't even know it because we're all afraid to talk about it with each other.
The U.S. government actually holds the patent to medical marijuana. The patent contains scientific data identifying research that lists illnesses marijuana has been shown to be effective in treating, in some instances, relieving the symptoms of the illness, and in others, the research shows it can actually cure a disease.
Neither of Senator Johnson's 2 bills on marijuana have been scheduled for full committee hearing.